Welcome to the University of California, San Francisco Sports Medicine Podcast, featuring Dr. Neeru Pandya, Dr. Brian Feeley, and Dr. Drew Lansdowne, discussing hot topics in sports medicine and society. We hope you enjoy our podcast and look forward to hearing from you.
Welcome, everyone, to our UCSF Sports Medicine Podcast, 6 to 8 weeks with myself, Dr. Neeru Pandya, and Dr. Brian Feeley. Today, we have the honor of Dr. Neeru Jayanathi, who is down in the South, originally from Chicago, where I was as well, too, for a period of time. And whenever you think of youth sports, his name is always at the top of the list. And I like to say the most quoted thing that I tell my patients is how many hours per week of sport they can be playing. I know you've done tons of more impressive research, but that is something that I will, on a daily basis, tell my youth athletes. So thank you again for joining us. And maybe you could just give our audience a little background about who you are and how you decided to choose this path about, treating young athletes.
Yeah, no, thanks so much. And it's great to have both you, Nirav and Brian. And you guys have done amazing work, not only in the operating room, outside the operating room, but impacting our field and rooting on those Golden State Warriors, which I know you passionately do. Hard not to like them. I have to, as a Bulls fan growing up, it's hard not to like them. But, first of all, I'm a dad of two boys, 7 and 9.5, and I'm living everything we're going to talk about. I actually taught tennis for many years, and we have a tennis medicine program here. I take care of a lot of tennis players, and my whole path really kind of started, about 15 to 20 years ago when I started researching youth tennis players, and we researched a lot of the high-level tennis players and found that some associations, and some of them were pretty obvious and simple. We had about 500 youth tennis players, and found that a couple of things. If they got injured previously, they're more likely to get injured. We all know that. That's pretty common data. But then also, if we got, if they had chosen a single sport, they're more likely to report injury and maybe even pull out of a tournament. And at that time, it was somewhat novel to report that type of finding. It just so happened we presented and published at the same time a book called The Open came out, which is the book about Andre Agassi. And that had gotten a lot of publicity. So we got some unintended publicity, and I had some media requests about the concept. And I said, well, look, we only have data in tennis players, but they were already extrapolating to other sports. So we decided to move forward with a much larger study, about 1,200 athletes. And we can certainly talk about some of the findings. And I realized, oh my gosh, really great people like yourself and athletic trainers and other people were actually reading these papers and listening to it. So I said, how do I stop? I have to kind of make this. It seemed to turn out to be kind of my lifelong passion now, since there's actually a few people reading this stuff. And it's very translatable. I'm not smart enough to do really, Brian does amazing cellular research. And I mean, probably couldn't even spell half the words that he puts in a proposal. But my research is very basic, like how many hours should you play, how many sports? And I think it's very translatable for the average coach, parent, family, and me, even my own kids.
So it's interesting because I came to this topic in early sports because my oldest one was playing softball, and we were at a tournament and she was the pitcher, and softball is kind of one of those classic sports where kids play a lot, they play year round. And if you're a pitcher, there's no backups on the team. So they had one backup, and one of the coaches on another team, for one, tried to mess with her delivery, which I thought was rude. But two, then said, you guys have to be playing all year round. You've got to really buy into it. And I went to an AOSSM meeting, and we're sitting around the research committee, and I asked, what are you supposed to do? And the room was split, and really learned people, half of them were saying, yeah, you need to specialize early. You got to get those kids in. And the other half were like, that's the path to injury. And in the end, with COVID and everything else, my daughter decided, I like science and I like going to school, and softball is fun. So the decision was made for us. But the more I did the research and the more I looked into it, the more it seems like it really is dangerous to try to specialize early. But my question for you is, why do you think kids are so eager to specialize in sports early? Or is it the kids, or is it the parents and the coaches?
Yeah, great questions. And we all live it. We're parents as well, too. I know Nirav is as well. When we looked at it, I look at the old models from the UK. There's a training of young athlete study about 20, 25 years ago looking at elite level athletes. And one of the first things they did was they had a model to say most kids choose a sport because their parents introduced them to it. That's how they get introduced, right? The far majority of them. Most kids intensify in a sport because that's what the coach asks them to do. So in our world, most parents trust that the coach will give them the proper advice. And I trust my coach. I think they're great, but I think coaches may have some unintended consequences if they are a tennis coach, softball coach. Of course, they want them to be with you and train with you all the time, with little data to support that. So I think the data was far beyond, behind in terms of telling us whether this is a good idea or not. So I think it's great. And we have our own friends, neighbors, and my own kids I coach and their friends. You get excited, your kid's good. And some coach tells you, I think you're great and you should join my team and be on a travel team. How do you not get excited and be proud? But then when you're 7, 8, 9, 10, 11 years old, and you're being told to do that, you don't see what we see, what you and I see. And that's a quick turnaround in their change and not only just injury, but their approach to sport. So we shouldn't make this an anti-sport specialization discussion, but I think it's generated by everyone else but the kid. The kid only has the enthusiasm, but that could be redirected in a lot of ways early on.
Yeah, so unfortunately, Nirav is the coach of his kids' teams. I've graduated from that for now, at least. He unfortunately drives all the kids to AAU basketball, and he's saying you've got to be playing 7 hours a day. So, so we don't want to be entirely negative against specializing early. What sports do you think there is a benefit in terms of, at least for performance, maybe not for injury, but where it does benefit if you are a swimmer or you're an elite pole vaulter? Should we be talking about this in a different manner?
Right, exactly. So, so we had a publication looking at sport type and sport specialization. And so if we look at from performance, we feel those early entry sports, what you're saying, should be the ones where you want to have peak performance prior to adult maturity or skeletal maturity. And so those could include gymnastics and swimming, diving, and some could argue tennis and technical sports, dance and other things like that. I try to stay non-judgmental with this because every sport has its own path. I think when you look at sport specialization decisions and athlete development, it's very sport dependent and it's very goal dependent. But there are some where you kind of need to do that if you're going to excel. And we looked at a study of the top 250 WTA women's professional tennis players as part of a larger study. Legally, I'm only allowed to discuss one portion of the findings, which is one slide. We asked the age that they played and trained in only one sport, and the median age was around 10. And it did make a difference in your future WTA ranking, whether you did it before or after that, which means that it's not necessarily the worst pathway, but it's not the best. There's just no current advantage to it. But what's also interesting, age of 10 is the same exact age that we found with 500 plus junior players. So whatever it is, these sports are kind of gravitating towards some certain age. And I think that's the culture of each sport. That's how tennis works. And as you guys know, that's gymnastics and other sports. The culture and dance is to go heavy and hard early, and culture and football is generally later. So my concerns go when this all bleeds into team sports that weren't really specialized before, and now they're kind of advertised as like, oh, early and often, when we know that there's no benefit in that group.
Yeah. It's interesting. One of the things that I feel like, as Brian was mentioning, kind of anti-sport specialization, it seems like we've swung where everyone's so focused on playing multiple sports, but the conversation about volume has gotten lost, like how many hours you're doing it. So, we have kids that are that my son plays soccer with who are, oh yeah, they're doing multiple sports, but then they're doing something 25 hours of activities a week. Do you think that it's more powerful from your research to limit volume and not necessarily, obviously you should concentrate and try to do multiple sports, is the volume should be the bigger driver as opposed to doing one thing?
Yeah, it's a great point. And so we did this publication called Training an Elite Specialized Youth Athlete, because this is all going to happen. We could do whatever you want, but the kids and the coaches and travel preppers are going to happen. So how do you guide them? So it's stage of development and choice based on the athlete development model. So in your we have, as you already mentioned, we have this, train less hours per week than your age model, which I think volume is definitely a clear driver. Our work shows an independent risk despite volume as well. So they're both risk factors among other things. So I think you're right. I think it's not this black and white, like if you specialize, you're good. If you don't specialize, you know, I'm sorry, if you specialize, you're going to get hurt and everything's bad. And if you don't specialize, everything's going to be fine. No, it's one of many athlete development factors in decision making. So what you're describing is a multi-sport specialized athlete. And I looked at it and I think I'm a decent, I always say I'm a pretty good dad. I'm a decent coach, and maybe I'm an okay doctor. And I looked at my own kids and I realized, gosh, both of them, I coached them both in everything. They were both playing baseball, and they were in, between them 3 times a week and 2 times a week. They were both in tennis, playing matches, and then we play for fun. And I was like, am I following all the rules that I publish? Like, I'm not even sure. So I know how hard it is to do for anyone else. And it's a challenge, and they're still young.
Are there certain sports where you feel there is no correlation with specialization and future performance? I mean, I know Brian and I have looked at NBA and things like that. Are there certain things where you parents come in, you're like, look, playing AAU basketball at age 8 is not going to make a difference? I mean, are there things where you're pretty clear on that with families come in?
Well, I don't even think you need to do a study on complete athlete development athlete sports like football. Like, we already know that it's a seasonal sport and there's really no advantage, right? And probably other things like wrestling, but and distance running and distance events. So those are actually late maturing sports. So even triathlons and running and all that stuff. So the bulk of them fall in under middle adolescence type, and as you know, team sports. You guys did a study, and I put your slides in. Brian sent me your slides a while ago. You did an NBA study about, really the ones that are first round draft picks, and where they fall as far as injury and how they do. And generally speaking, the specialized ones don't do that well, right? But also 85% of them were specialized. So they're still doing it. So there's still a driver. Like you can. So we don't have the performance data. So they don't care as much about that injury. You could say it all you want, but we don't have the performance data that you are going to be, because there's still, this thought that you need to. So, but it is the volume. It's volume and the choosing the sport. The volume is. What's the biggest risk, and you guys know this, but for those that don't research this, it's competition volume is the number one risk.
Yeah.
Right. And so that part, and I was just on a different panel with NATA, and we talked about where I think the data is. I think we've advanced our injury type by about 4 years. So the things we see in 20-year-olds, we see in 16-year-olds, things we see in 16-year-olds, we're seeing degenerative changes in tendons. I just did platelet injection in 15-year-old soccer girl, and tendons that look like someone who'd already been through 4 years of college and 2 years of professional athletics. And it was hard for me to have to do that, but I think we've advanced things because of all of it, the volume, the lack of rest periods, and those types of things.
Yeah, I think it's interesting when you look at the differences. I think part of the problem is that we do allow coaches a lot of control, because we say, well, if you want to be on the, Georgia United soccer team, no offense to if there is a Georgia United soccer team, you need to hit 90% of practices, 75% of games, and otherwise you won't play. And what I try to tell the kids in clinic is like, well, then maybe you need to find a different team with a more understanding coach, because that's not realistic. What do you think the primary driver is as kids hit that high school age? Do you think that's where it transitions more to kids driving the bus or the car, or do you think it's still coaches, showcases, and that parent drive for, I want to see my kid be scholarship X, scholarship Y?
Well, I mean, you may have the same communities. I mean, a lot of our communities we're in a pretty affluent community out here in Johns Creek, Georgia, and a lot of the athletes are just trying to make their high school team. I mean, forget even college. Like, what you have to do to make a high school team it's not easy in these types of communities, and I think that's completely admirable, even if it is college. So the driver is the entire environment, and so if I had to be really honest, it's probably more driven by the exposure and travel and club teams than it is by scholastic sport. And so scholastic sport alone, which is your high schools or school-based sports, those are the ones that some of these kids are willing to give up, so it doesn't affect their travel, and that's where they seem to get the biggest exposure. My personal feeling, as much as you and Nirav and me and a number of other people will try, we're not going to be able to change all of this big bus of, travel sports, club sports, and the financial engine behind it as well too. What we should work on is the alternatives. So when parents look at choices, they have better alternatives. And that is alternatives that don't stop at 12-year-olds for recreational sports or intramural sports in high school. Or, if I can make a plug, my wife started an app that just came out, Pick Up Sports, which is allowing neighborhood play and meetups where you just say, create a pod and say, we're going to play soccer on Sunday with these 8 kids, and these are the levels, and meet up and do that. And, and reinstitute some of the things that probably you guys did and I did when I was younger is, and I'll add this, is self-directed free play, we think actually may be protective of injury. And, we had a study looking at socioeconomic determinants, and the kids who came from wealthier insurance and families had higher rates of serious overuse injury, but yet the kids who had lower rates of serious overuse injury had less money and played more. They had more physical activity hours. But when we looked at it, it was majority of that was directed by free play. So they were playing pickup basketball in the neighborhood. And then when they said, I feel tired or hurt, I would stop. And so it's really interesting to say that it's not just, it's how the volume is delivered, right? Not just the volume, but how it's delivered.
And, I think one of the, oh, go ahead, Brian. Yeah, go ahead.
Yeah, I think that's really interesting. I noticed that when I cover high school football, there's a bunch of boys hanging out in the corner. This is going to sound really bad, but they're basically off on the side field playing pickup basketball, goofing around. And you rarely, if ever, see girls doing that. And what I see, because I've got my oldest 3 are daughters, but I see especially around the oldest 2, there's this pressure and intensity to be, I have to make club team X, I have to make varsity next year. Do you see a difference in terms of gender in how that free play has developed?
Wow, that's actually a really great point. And even when we talk about like the thing my wife is doing, Pick Up Sports, we really want to make it gender neutral and just get kids to play and target the girls, because the drop off is with the girls between 11 and 13. I will tell you that when we look at our data, and we published just basically on the adolescent female athlete, the biggest driver for a lot of this stuff is actually the young female athlete. And so, yes, there are risks for the guys and all these kind of things, but the biggest driver continues to be, if we look at our data sets, is the young female athlete. And you're exactly right. It's mostly in organized environments. And if I actually, and I'm as guilty as anyone. And we're working on it. I'm with my new discovery research student at Emory. We're going to do more gender specific studies, but this will really look at these type of findings in only the female athlete. But I bet you if we looked at free play hours and ratios that we do, we call it a sports training ratio. I bet you it's a significant difference between boys and girls. And actually we hadn't looked at the data, so I'm going to actually make sure that's something we'll look at our next data set. But I bet you're right on that.
Another group that we don't talk about in the specialization kind of like, era overuse is what happens to the other kids who don't have access and don't play. And one of the things I've seen in my clinic, it's kind of this dichotomy. You've got the super specialized third ACL tear when they're 14. And then you get the 12-year-old who's got anterior knee pain, hip pain, because there's nowhere for them to play. What kind of things do you think, in general, we can do to kind of improve opportunities for those kids? Because they're getting left out. And I think we don't concentrate on that aspect of it as much.
Well, you're exactly right. And let's take away my research bias of looking into the injury risks, and you guys, and we look at that group because they're the people we see in clinic, right? And they're the overutilizers. In fact, that's the high risk group. We looked at longitudinally, we had 1,200 athletes, then we followed them. We actually noticed they're great for business. You get a high specialized year-round athlete, they're going to be your best friend. They're going to be there again and again and again. But the kids you're talking about disengaged from sport, the attrition's high, and I completely agree. So all our efforts really should be a little bit what I talked about is focus on other opportunities that are that don't stop at 12. So most rec leagues, like once you can't figure out you can't make your club or travel team and you can't make it in high school, you're done. But we don't, but like in Atlanta, when you're an adult, we have these tennis leagues that are just amazing. We have 80,000 adult players, and half of them, we've researched them too. Half of them start picking up after 18 years old, but it's organized. It's in your, and you could be C9, like the lowest level, and still have a ton of fun. And so we're trying to replicate that with kids. We're trying to create a model that involves, that is self-directed play. You just meet once a week. If you can't make it for one season or one weekend, no big deal. It's okay. And you jump in when you can, but then you're self-motivated. And I'm telling you, there's a lot of not so good athletes playing these, but they're passionate about it and their social structure is built around it. So when you get a social structure built around it, and get opportunities. Now, I think school is a great avenue. We've pulled away from school environments, and because all this other stuff, because you got to win and get the best teams. But school is your first environment, and it should start from elementary to middle school to high school to create intramural and recreational opportunities for every level.
Yeah, I was surprised when our oldest one went off to UCLA. We had to explain what intramurals were because it's an unheard of thing to have free play and to play like pick up semi-organized sports now until college. Whereas in reality, I think I spent much of my time outside of actual sport time playing pickup basketball or playing pickup baseball poorly, but still having fun playing sports. I really want to ask you what your rank is in Georgia, since I know you know it, but I'm going to conclude with a different question just in case it isn't in the top 10. How do you see the future of youth sports going? Do you think it's going to switch away from this model, or we're going to kind of have a reversal where we put more fun into the youth sports, especially in that 12 to 18 year range?
Yeah, and we've all been on national committees and advocacy programs, Aspen Institute, and you name it, been in the media a lot. And I think there's little snippets of it with national governing bodies, but I actually believe it's not realistic to think that this engine isn't going to keep going the way it is. And you guys have been around this for a while, and I don't know if you could say that it's reversed a lot. So I think the future of youth sport is what it is right now. And until we create other opportunities, and you need more people focus on other opportunities. And it's interesting. My wife, she's done kind of the market research behind it. When we need to do it is actually early, right? We need to do it and create that culture of free play and playing for fun, all these things at 6 to 10. But they're not unhappy yet. And so we actually are trying to kind of sell this idea to families, say, what, like they always say, what should I sign up for? I'm like, you don't need to sign up for something. Why don't you just play for fun? And then she's done a little bit of market research and found that they're not happy at that point yet because they're still excited and passionate. But I think we have to help. You guys have already lived it, and Brian, you're ready for grandchildren almost, and you've seen you've already kind of gone through, with your kids. You've already lived it with your kids. You've gone through. But to explain to new parents of kids entering the sport world that get the better alternatives early, take your foot off the pedal, and try a culture of playing for fun, meeting up in neighborhood play, and doing those things, so that it doesn't feel like this pressure cooker of sign up for the next thing, sign up for the next thing, and sign up for the next thing. But there's a lot of work to be done, and we're a small part of it. Like, we're in the medical side. I think we're a tiny part of it. It's the coaches and then the business behind it. If there's a business model that'll get coaches excited about getting more kids to play, then I think we have a shot.
Yeah, totally agree. I think, as we feel this burden to change the system, where we really need to be incorporating in the folks on the business side, the coaches, not even the parents, or so the people who are providing the opportunities, which I think gets lost a lot. So, and then the social part as well too. I think for a lot of these families, like travel sports, those parents are what you're doing every weekend, and then suddenly to withdraw yourself from that, it's tough for the kids. And then the parents are like, well, what are we going to do all weekend? These are the 13 parents we've been hanging out with, so there's this pressure as well too.
Mm-hmm. And it's fun. I mean, I think it's great. Like, we're playing. I mean, I coach my son's is playing for the championship game tonight. Yes, he's 7, and and this is his 7th season in baseball. And I'm the coach for all of them, as we control the environment. And I will add, let me tell you that the other coach is great. from California. He played a little bit of professional football. Neither of us the entire season ever said the score, nor ever told them that they needed to do anything, get a hit. We never made it outcome dependent. And we were the #1 team in the league, and we're about to play for a championship. And all we did was ask for energy and fun. And we're very proud of the coaching style. And it can be really positive. And we've shown before that you can have really positive environments. And then we'll ask at the year-end party, I always bring a bunch of tennis rackets, and then I try to convert them all to tennis players. And I just say, play a different sport. That was great. We had fun, but now play a different sport, And so, it can be done. And we just need more people, more coaches and communities doing that.
Absolutely. Well, we could go on for hours about this because
Yes.
obviously we're all passionate about it. But
Yes.
just wanted to thank you again for coming on our podcast and working with you in the future. This will be great.
That's awesome. Thanks so much, guys. And I want to cheer for the Golden State, but I don't want them to get their 6th championship and ever be compared to Michael Jordan, the Bulls. So please just don't get your 6th. Keep it at, keep it just at 5. That's it. That's all I ask. Okay.
Awesome.
Keep up the great work, guys. Thanks for having me on. Okay. All right. Take care. All right. Bye-bye.